terms of actuarials and those kinds of things, what about the cherry picking cream puffs? That's kind of scary.
So one of the things in the 20 pages is that it talks about how insurers, medical homes or accountable care organizations would be reimbursed per member per month, actuarially adjusted. So what that means is, you know, a 65-year-old person who's had a heart attack, we know they're going to cost more money to take care of than a 20-year-old person who's completely healthy. Plus it's a woman that might have a baby, that's a different story. But anyway, so the per member per month payment for those lives would be different, so that there was financial incentive to take the less healthy people, because you would be reimbursed more, and if you really could do a good job of keeping them healthy, you have the potential to have not only a state-of-the-art healthcare system, but one that's financially viable for you as well. There was a great article last month, and I tell you guys all this, in the New Yorker called The Hot Spotters. It tells a story of a doctor who intentionally picked the hardest patients just to prove that he could keep them out of the hospital and keep them healthy, and he could. And so that kind of person, you know, that was their love, is, you know, I know that people can be made healthy if you let me do it the way I want. Then yeah, that person could be paid extra to take care of those people and keep them healthy.
Is there any, and I'm sorry, I'm excited to get a copy of the movie. Is there any reference to existing conditions that will anybody be turned down if they sign up for co-op?
No.
When you're done.
So the question was, is there any exclusion for pre-existing conditions? And the answer is no. Absolutely not.
I'm just wondering, what it seems like, and I could be wrong, it seems like some of the huge contributors to the cost of medical care is the enormous amount of money doctors have to save for this support. And is there any parallel effort to try to bring down the cost of public education, private education, so that doctors don't start accruing hundreds of thousands?
Now, on national bills, they've tried to do that, but you can't really do that on a state bill, because if we, you know, pay for the doctors to be educated here, they scatter across the country.
Now, you know, one thing that might happen, like what happens now, is in Colorado, we actually do have loan repayment if you're willing to work in underserved areas. And so that's the way in which it's incentivized to try and get doctors to the underserved areas. And do they do that for nurse practitioners, Brenda?
Yes.
Good. Brenda?
I was going to ask about any willing provider being able to get into your network.
Yeah. The idea would be that...
thinking about nurse-led questions because we can't.
Okay. So her question was, would any willing provider be eligible to be a part of the network? And yes, you know, we do have a shortage in our state of primary care providers. And there are a lot of nurse practitioners and even physician's assistants who do some primary care. And so one of the goals of the system in allowing innovation is that a lot of times doctors with MD degrees are doing things that even that RNs could do, or that a well-trained layman could do. Likewise, nurse practitioners are not always allowed to practice to the extent of their skills. And so one of the principles around efficiency is that you have the right person doing the right job in the right place. And I would imagine that there would be people who choose to work under the model even of working out of schools, working out of factories. I mean, that's where I think we can see innovation come up, is how providers choose to organize their patient-centered medical home. You know, and that reminds me for some reason, earlier when I mentioned about how it's not like an HMO, part of what we set up in this, and I won't keep referring to the 20 pages, but was that there would be things that the cooperative itself would fund above and beyond paying medical homes and integrated healthcare systems a per member per life fee. For example, if you read or know much about medical literature, it makes a big difference where you get your transplant done. It makes a big difference where you get, if you have an aneurysm in your brain, where you get a coil inserted into that aneurysm. And so there are certain things where you might want to, as a cooperative, be paying for them to be done only in one center of excellence and not expect the individual plan to take care of that, because you want for the entire population the best outcome at the best price. And often if you can get it done with the least complications, that's the best price.
How would that work with HMOs that have their own hospital built into their system?
She asked, how would that work with HMOs that have their own hospital built into that system? Even doctors and nurse practitioners who are part of patient-centered medical homes will need a referral hospital, because despite our best efforts, sometimes people need to be in the hospital. And as a state, we need hospitals or access to hospitals available all around the state, because there are conditions that are best or only treated in a hospital setting. I mean, the thing that comes to my mind is trauma. The other thing is, if you're having your first heart attack, there's a lot of great things that need to be done within the first 4 hours, similar with stroke. I think it's 2 or 3 hours. So part of what is kept out of that HMO model for the cooperative is to look at how do you establish access to emergency care all around the state for everyone. And we do need hospitals to exist. But hopefully we won't be using them very much. And so it may be that the cooperative has to pay some money to keep a hospital working because it's not getting many patients, because we're keeping people healthy. And that would be cool. In that article I referenced in the New Yorker, they talked about Denmark, where they went to integrated healthcare systems and patient-centered medical homes, and they went from having 152 hospitals to having 90 hospitals. And they're expected to go down to 75. So if your healthcare system does a good job of keeping people healthy, and unfortunately hospitals are a dangerous place to be in this day and age, and keeping people out of the hospital, hopefully you don't need as many hospitals, but you do need them to be there for those critical moments.
I want to respond to the other side of that question about what do you do if you're in an integrated system and they have a hospital in it. I think you were saying that. Yeah, and this is why we need the consultant. The consultant has to come in and write down those rules. But if you're an integrated system and they have a hospital within it, that's fine. But they still may need to send their children, the children's hospital. Their integrated delivery system, healthcare system, is responsible for the health of its members. It's not just, oh, well, we happen to have a neurosurgeon instead of a cardiologist, so we'll send you to the neurosurgeon. They have to have somebody to do everything or pay outside of their system. And the consultant comes in and writes all these rules so the system works together. So that's why we have to do it in a step-by-step way.
I have active 32 members of in trial to go free. 32 members. No, it's real. And it's right down there in this 32 members.
I know this is frustrating.
Yeah.
You know,
Yes, sir.
I'm rural, I'm a small business, and I'm seasonal. How can my employees be covered when they're working for me and then they disperse during the winter season and what?
So one of the goals of this cooperative idea is to come up to 21st century employment, which is that many people don't have just one employer for 40 hours a week or one employer for all their life. I forgot the statistic, but it's like people have about 9 different employers over 20 years or something. So this would be independent of employment. It's not tied to your employment, but employers would likely be asked to make a payroll contribution on whoever they're actively paying payroll on. So, and the reason for that is mostly in deference to what's happened over the years with the payment of health care benefits and wages for lower income earners. Lower income earners for many years have given up wage increases in order to cover their benefit increases. And so you don't really want them to lose all that hard-earned income that is going toward paying for their benefits. Yes?
Thank you, Senator Aguilar, for pushing this ball down the road. I have a question about the design phase. And whether or not in this year and a half or so of the design phase, there will be a requirement, if you will, for public input and more information from the public about what we want as Coloradans.
There actually is a requirement in there to have at least one public forum before it gets presented to the legislature. And
Actually, I think it's more. It's required to have public input and at least one draft copy submitted to the public for feedback.
yeah.
But you know, nobody's going to win an election if the public isn't involved. You know.
Yeah, we definitely would like there to be public feedback. And I think the other thing is that I think sometimes people think that that things are proscriptive, meaning telling them exactly how they do something. But really, all we're designing are the edges, and what it looks like in the middle will be completely up to the individual systems to design. And we want that kind of innovation because we don't know what's going to work. And in addition, what works here in downtown Denver might not work in Greeley, and it might not work on the Eastern Plains. I mean, you want each area or each population to design the system that works for them.
I know you explained this earlier, but I'm still confused. How would this cooperative mesh with the health insurance exchange that Colorado is developing?
So what I actually have been asked quite a bit. People have been worried that in some way that we're going to undermine the exchange. But actually, as you know, the goal of the exchange is to provide access to quality, affordable health care for everybody. And so if this cooperative is accepted by all the people, and again, that's one big question, is it mandatory or is it voluntary? If it's mandatory and it gets voted in, it probably would at some level make the exchange not needed. But it could utilize a lot of the infrastructure the exchange will have set up around bills and tracking and things like that. So a lot of the hard work that's going on right now could be turned over, but it would just be working for one insurer instead of 10 or 20. Because essentially it is an insurance product, it's just a self-insurance product. Yes?
Like, I love the idea of the cooperative, but have you thought of, or have any plans in place for, and I'm calling it for marketing this before, and I use the word marketing deliberately because I can just see now that certain factions, lobbyists, industries, whatever, are going to start screaming and yelling that this is socialist, that this is anti-business, that this is whatever. And do you have any plans in place to kind of preempt this and get information, the correct information out to the public about this and what good it will do them?
Yeah. So right now we're doing a lot of public forums around the state in regard to just House district and Senate district meetings. We're willing to do that wherever we can, and we're more than happy to come anywhere that anyone wants, not necessarily me, because I only have so much time, but you know, we have a number of people who are well trained in this and discussing it. And so we do plan to have a massive education effort. My friend John Shapiro here is working on developing a website that would explain things to people as well. And our goal would be that when the consultant has made the plan and knows what the benefits would look like and what it would cost, that we'd have a website where you could punch in you and your family and your income and find out what it would cost you to be in the cooperative and what benefits you would get as compared to what is the best product or the least product available on the exchange and what it would cost you and what the benefits are that you would get, so that you'd be able to have some real firm numbers to look at with regard to what happens to me. You know, it's really easy to scare people away from any idea that's new, and we all know that. But we also think that if we can give you concrete numbers that will help with concrete information on what the benefit will look like, but also that if you you start with the education now for 2 years from now. I mean, we barely have enough time, but we need anyone who's supportive of the idea, work on getting us out and into as many forums as possible to talk with people about it. You remember how, and I don't know, for me this was really I was very sad to see that President Obama had to extend the tax cuts to the wealthy,